Well, good afternoon, and thank you for attending the NACNS Nomination Committee's webinar concerning this year's kickoff to the nomination and election season. I am Mike Hartman, and I'm the chair of the Nomination Committee for 2025 through 2026. And with me is committee member Josh Smith. Thank you all so much for joining us, and I hope that this session educates and helps you spread the message to our colleagues to serve the NACNS this upcoming election season for several positions that we will discuss. These are the nominating committee members for 2025 through 2026. Current members include myself, Linda Cole, Allegra Del Rio, Brittany Rhodes, Josh Smith, Kimberly Pate, Tina Credden, Christy Mitchell, and our board liaison and immediate past NACNS president, Jennifer Manning. Our contact information can be found at the end of this presentation. For those of you who are considering running for an NACNS position, our committee members will be speaking to you throughout the application process.
Our goal today is to provide some information about the elected positions that would be available for the 2025 to 2026 election cycle. Along the way, we'll talk a little about the benefits of service and anticipate some questions about the processes and next steps. While we won't have an open line for questions, we encourage you to use the chat box to submit your questions, and we will do our best to address them at the end of the presentation. You're also welcome to email myself or any other committee members if you have specific questions or comments, and we will provide that information at the end of the webinar.
NACNS needs the time and commitment of its members in order to function. It's just that simple. We're all busy, I get it, but if we want to see our role supported on the national stage, there needs to be an organization with active members making that happen. NACNS represents us through a presence and voice on various national stages or with other professional organizations such as ANA, HHS, or the NIH. Having the CNS professional at these tables with other APRNs and colleagues is so critical to the role's success. And while NACNS still has opportunities for membership growth, the CNS network supported by NACNS provides a forum to reach across state lines and build networks of APRNs that can help to more fully implement the CNS role. You each bring a wealth of experiences and expertise that strengthens the organization during your service, which elevates us all. Service with NACNS ensures that the activities of the organization can function, continuing to serve our CNS member base. As a volunteer organization, NACNS depends on the service and leadership of its members, its board of directors, the various committees that we will discuss, and other valuable teams necessary to function. Finally, having outstanding volunteer leaders in the organization provides an essential pool of experts to serve on other outside organizations. Once they learn about us, everyone wants a CNS on their team.
NACNS's value is closely connected with its promotion of the CNS role. The NACNS's work helps to ensure the role of the CNS will continue to grow and succeed based on the strength of the membership and organizations that support it. While the CNS role is active and lively in some parts of the country, our presence is still shrinking in many states. Programs continue to shutter due to low enrollment and limited opportunities within the states. NACNS supports the role through national practice support, advocacy, practice data surveys, and documents such as position statements. And this helps to bring attention and awareness to what CNSs can do for hospital organizations. As healthcare continues to evolve, the CNS role needs to be positioned in order to evolve as well. In many of your organizations, COVID-19 served as a great example of how this critical expertise and adaptability of the CNS role served hospitals during complex situations. Service opportunities and volunteer work allows you to help drive the role forward in various ways through NACNS activities and initiatives.
I'm sure the bigger picture is enough to inspire each of you. So let's talk for a minute about what is in it for you. Service with a local, state, or national organization provides you many professional experiences that can add to your toolbox. These are a few that we've identified, but depending on where you are in your career, the personal benefits could go well beyond these. Gaining greater confidence and competence as a leader and communicator amongst your peers is invaluable. Additionally, while you're all highly skilled and knowledgeable in your own clinical and organizational environments, service within NACNS can be a great chance to expand your scope and perspective, learning where you might fit, enhancing the role of the CNS. Additionally, service within NACNS presents you an unmatched opportunity to network with other CNS rockstars from across the country. As we all can attest, one of the most powerful skills a CNS has is their network of experts. And of course, most organizations value volunteer service, especially for national professional associations.
We will discuss open positions for the nominating committee, boards of directors, secretary treasurer, a dual role, and president-elect. Let's go ahead and start with the nominating committee. I joined the committee in April of 2025. And we have 8 members total, each serving 2-year terms and 4 members rotating off every year. So for 2026, NACNS will be looking for 4 new members. Our primary responsibility is putting together each year's ballot for NACNS leadership. Additionally, we support the board of directors and membership with any other needs related to candidates, as well as the election process. For example, our committee recently supported efforts to improve board member representation as it relates to our membership composition.
Our work within the nominating committee primarily takes place from March through October, where we conduct educational sessions like this and screen and interview potential ballot candidates. Depending on the number of potential candidates for a position, we may also need to do a little additional networking to ensure that we have a good selection of high-quality candidates. Overall, from March to August, we usually hold monthly 1-hour conference calls. A busy time is usually in August to September, when we are preparing the ballot and conducting applicant interviews. During these 2 months, you can expect to spend 2 to 3 hours on conference calls and applicant interviews. I'd also estimate another 1 hour per month in November and December as we wrap things up for the year.
For the board of directors, we maintain 6 total at-large members, with 3 rotating off every year, so there are always members with experience on the board. Members ensure all activities fall in line with the strategic goals of NACNS and the CNS role. The board is responsible for financial stewardship of the organization and is ultimately responsible for supporting its members. These members participate on committees and groups, etc., as representatives of the board. Our members at large advocate for the CNS role and CNS practice with any opportunity that they may have.
The time commitment to be a board member is about 2 hours a week on average, with additional monthly commitments. There are monthly meetings, which averages about 2 hours a month, and 2 of those meetings are face-to-face. One is at the NACNS conference, it's all day, another one at another time of the year. During these meetings, there's an emphasis on professional development with relation to the board, which can evolve with the changes of the world, like the changes in workflow we had during COVID. Additional time for community participation is about 1 hour a week. So in total, you're looking at about 12 to 15 hours a month being a board member.
The secretary treasurer role, as I mentioned before, is a dual role for 1 volunteer. The NACNS secretary treasurer is responsible for overseeing the recording of the proceedings of the meetings of NACNS and the management and reporting of the organization's finances. They work in collaboration with the bylaws committee, finance committee, board, and staff to ensure that the roles and responsibilities are met. This person is also responsible for the financial and operational functions of the board, including communication alongside Virtual Inc.'s teams, to include keeping the board regularly informed of key financial events, trends, concerns, and assessments of fiscal health, in addition to completing required financial reporting forms in a timely fashion and making these forms available to the board. Much of the work can be delegated to the finance committee and staff or volunteers as appropriate. The Secretary Treasurer will convene the Bylaws Committee prior to the annual meeting to determine if bylaws changes are recommended. The Secretary Treasurer, in collaboration with the board and staff, will keep members regularly informed of key events and decisions of the board via oversight of delegated association communication functions, including but not limited to the website, blast emails, newsletters, and reports of the annual meeting. In addition, the Secretary Treasurer will ensure that the staff completes required financial reporting forms available to the board. And much of this work may also be delegated to the Bylaws Committee and the staff or other volunteers as appropriate.
The time commitment for the Secretary Treasurer role is about 4 to 6 hours a week on average, with the additional monthly commitments as Josh had explained. These monthly meetings can be about 5 hours a month and involves the board of directors, the executive committee, and the finance committee. There's also a face-to-face board director meeting, which you'll have to attend. That happens twice a year. Again, one at the conference and another one determined during that year.
The president-elect serves for a total of 3 years. First as president-elect, the second year as president, and the third year as immediate past president. The president-elect, in the absence of the president, shall preside and assume the usual duties of the president. It's the duty of the president-elect to regularly attend board meetings and other related meetings, participate actively in committee work, possibly serving as a non-voting member of all committees and task forces except the nominating committee, and serve as a member of the board and executive committee, as well as the finance committee. The time commitment varies based on role, with the president-elect and immediate past president providing fewer hours each week, around 2 to 4, while the president has more direct responsibility and may provide between 2 to 8 hours per week. The president-elect can anticipate serving 4 to 6 hours a week on average, with additional monthly meetings. And this can include monthly calls with exec meeting, operations meeting, and CNSCI. And these monthly meetings average about 5 hours per month. 2 of those meetings are face-to-face, one at the conference, which is all day, and another time during the year. And these meetings have an emphasis on professional development with relation to the board, and can change or evolve depending on the wants of the organization.
So here's a look at the time commitments associated with the years of service involved with being president-elect to president and immediate past president. It is a long 3 years of dedicated service where you can make a huge impact on CNSs all around the world. As president-elect, you see there that the commitment really jumps up as you enter your presidency year, where the commitment is around 80 hours a month. Then in your past president year, the hours return to where they were when you were president-elect.
We want to be sure that for anyone interested in the board of directors role, that you're aware that this is a working board. These board members are responsible for participating in the program, fundraising, administrative work, and any operations that are needed to sustain the organization and continue to promote NACNS and the role of the CNS. The board member is also responsible for contributing financially to the CNSCI. And although there's no set amount for this contribution, there is an expectation that the board member supports what we are putting our time into.
Now we will share a few final tips on the process for applying to be on the ballot for these elected positions. First, here's a quick look at the timeline and process. You likely saw an email last week or this week from NACNS with a call for nominations for the elected positions. The listed positions available, all of which we just discussed today, and the link to apply can be found on the NACNS website at the conclusion of this webinar. The application is live, web-based, and includes a few short response questions in addition to a required CV and photo. Call for nominations will open today, 24 July, and last through the first week in September. All potential candidates are interviewed by nominating committee members, which lasts about 30 minutes. These interviews will be conducted via video when possible. Following the completion of the interviews, the nominating committee builds a provisional ballot for each position, and this is submitted to the board of directors for approval, which will be in early September. Once the ballot is approved, NACNS will send it to the members for a vote. This usually happens sometime in mid to end September, with a few weeks provided for voting. Those elected will be notified in November, and service will begin in March or April 2026, with meetings being held after the NACNS conference.
Finally, we wanted to say a bit about experience and representation. NACNS has worked for years to ensure that the organization's leaders are as representative of the membership as possible, but that is always challenging, even more so in smaller organizations such as ours. We want leaders who represent various specialties and settings. For example, this may be inpatient, outpatient, academic, industry, or military. We also want folks with diverse educational background, which may include masters, DNPs, or PhDs. It's also helpful to have leaders from a variety of populations served. For example, pediatrics, adults, women's, mental health, peri-op, and ambulatory. And we also need leaders to serve in a variety of areas. These may include different communities or task force. Another example is those who perform community or local CNS work. And perhaps you may work at the affiliate level or have experience at the national level, and we can use your help. Finally, we certainly want leaders who are diverse with regards to gender, race, and ethnicity. If some of you on this call fail to see yourself represented by the organization as leaders, whatever those characteristics may be, I would strongly encourage you to step up, answer the call, and consider serving. We want to ensure that everyone is represented throughout this process.
After this call, if you have any further questions about the nominations or the application process, please do not hesitate to reach out to me or Josh or other members with questions. Our contact information is listed here, and either one of us would be happy to speak with you. Additionally, this webinar is being recorded and will be available for review if you're interested in participating in this year's election cycle. Finally, here is a list of my nominating committee team group. Feel free to reach out to one of us individually if you prefer. We look forward to speaking with each of you during your candidate interviews. Thank you so much for joining us today. Thank you to Josh for presenting with me and those who helped organize this webinar. We're going to take a moment to check the chat box to see if there are any questions that we may answer.
Doesn't look like there are any questions that have come in at the moment, but we'll give everyone a minute in case you want to ask anything.
Sure.
Okay. Dawn is saying this information is very helpful and thank you. Tess as well.
Thank you.
Right. It doesn't look like we have any further questions at the moment.
Okay. Well, I hope everyone sees our contact information, and if there's any questions, please don't hesitate to reach out to the nominating committee.
And I just saw a message from Mary asking when the video will be available. It should be available probably early next week. And if you want to send an email to info@nacns.org, I can go ahead and send you the link as soon as it is available. Yep, you're welcome.
And if I could just add one more thing, just for clarification, the secretary treasurer role was recently filled, so we won't need that again until next year's election cycle.
All right. Does anyone else have any other questions? Okay. Well, if we don't have anything else, then I will go ahead and end the webinar. Thank you, Jesse and Josh.
You're welcome. Thank you for organizing this for us.
Thank you.